Your eyes could reveal if you have ADHD or autism. The most common screening tests for ADHD and autism are not accurate. I think I have ADHD or, I think I have autism. These are common phrases that people say when they're not sure what they're going through. But the most common screening tests for ADHD and autism, known as the DSM-5 and IDO, respectively, are not accurate. The DSM-5 is a diagnostic manual that has been used to diagnose mental disorders since 2013. The ADO is a diagnostic tool used to identify autism spectrum disorders in children. The DSM-5 was supposed to be more sensitive than its predecessors, but it's actually less sensitive than the previous edition of the DSM-4. The ADO, on the other hand, is less sensitive than an older test called the Autism Diagnostic. The eyes are the window to the soul, or so they say. They can reveal a lot about a person, their emotions, and their feelings. But what if our eyes could reveal more than just this? What if they could tell us whether or not we have autism? This is what researchers from the University of South Wales and Cardiff Metropolitan University in Wales are working on. Scientists have developed an AI algorithm that can detect autism by analyzing eye scans of people with autism and comparing them to those of people without it. Is it possible to diagnose ADHD or autism with a test of eye movements? The eye test for autism and ADHD is a new study that has been done to see if it is possible to diagnose autism or ADHD with an eye movement test. The study was done by Dr. Golan Shahar and his team in Israel, and they found that the eye movements of children with autism or ADHD differed from those of children without the disorders. This study highlights the importance of early detection of these disorders, which are both neurological developmental disorders, so that treatment can be started as soon as possible. What is the eye movement differences between ADHD and autism? ADHD and autism are two different disorders that have many differences in their symptoms. One of the most notable eye movement differences is the way in which they look at objects. In ADHD, people tend to scan their eyes left to right or up and down, while those with autism tend to focus on one object for a longer period of time. In addition to eye movements, there are other differences between ADHD and autism. For example, those with ADHD seem to be more hyperactive than those with autism, and they also have trouble staying focused on tasks. Those with autism also have trouble socializing and communicating verbally, as well as maintaining eye contact during conversations. What is an eye movement test? Eye movement tests are used to diagnose a number of conditions including autism, ADHD, and dyslexia. Eye movement tests are often used to help diagnose autism, ADHD, and dyslexia in children. The test involves following a set of dots on a screen with their eyes and seeing how they respond to the different stimuli. How to perform an eye movement test on yourself at home. This video will discuss how to perform a home eye movement test on yourself. Eye movement tests can be used to diagnose ADHD and autism. The test has been conducted by following the subject's eye with a pen or finger while they read. An eye movement disorder would be revealed if the eyes are not moving properly and do not follow the direction of the pen or finger. The most common way to conduct this test is by sitting at a table and having someone else hold the pen or finger at a distance where you can still see it but it's just out of your reach. You should then read aloud from something like a book, magazine, or newspaper for about 5 minutes while they watch your eyes closely for signs of an eye movement disorder. The use of AI software in the diagnosis of autism and ADHD is not new. The introduction of AI-powered diagnosis tools has made it easier for doctors to diagnose and offer treatment to patients with ADHD and autism. The need for diagnostic tools that can accurately pinpoint children's disabilities has grown in recent years, as parents have accused schools of not adequately identifying their child's needs. AI diagnostic tools are also used in the treatment of ADHD and autism. For instance, a virtual therapist might use AI-powered software to help identify triggers for behavioral issues or help with problem-solving skills.